Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today, we have a family nurse practitioner with us that has truly been an inspiration for all of us in the American College of Lifestyle Medicine and in the larger community of people practicing lifestyle medicine. Erin Sinnaeve specializes in allergy immunology and lifestyle medicine in the greater Chicagoland area. She's also an instructor, an adjunct professor at Chamberlain University, where she teaches the graduate level course, Population Health and Epidemiology. And she's also a speaker through PESI, P-E-S-I, which is a provider of continuing education for healthcare professionals across the country. She's been committed to supporting development of new and the expansion of existing initiatives and partnerships to improve the health of patients and communities by promoting health equity through lifestyle medicine strategies. I know we're really excited to talk to her about that today. So she's an active member of a few organizations. I'm going to tell you what they are. The Physicians Committee for Responsible Medicine, also called PCRM, the American College of Lifestyle Medicine, the ACLM, of course, where she served as the secretary for the member interest group called Health Equity Achieved Through Lifestyle Medicine, otherwise known as HEAL. She's also a member of the Kane County Health Department Partners in Health Equity Committee. And Deborah and I are so excited to talk to her and share with you how lifestyle medicine intersects with and helps to address the pervasive health inequities that exist today. And no doubt a lot of progress has been made over the last few decades, but there is much more to be done. And as nurses, we hear the call to action from the Future of Nursing report and also by other organizations, and how COVID has really put a spotlight on these health inequities within our healthcare system and the larger community. So welcome, Erin. Thank you so much for joining us.
Thank you so much for having me. It's an honor to be here.
Okay, so what I love to start with is people's origin stories. So tell us about how you found lifestyle medicine, how you even got interested in it, and then your current roles right now.
I've been working in healthcare for almost 30 years, and I've seen the explosion of lifestyle-related diseases, as I'm sure a lot of you have. I was working in multiple different areas, including like the operating room as a nurse, circulating more and more bariatric surgery cases. I saw more and more patients with complex problems and heart disease, strokes, diabetes, cancer, and I thought, there has to be a better way, right? Why are we seeing this uptick in lifestyle related diseases? And then I learned about the impact of diet on disease prevention and even reversal, watching two documentaries specifically, Hungry for Change and Forks Over Knives, which I'm sure a lot of you have heard of. And I was always very big on exercise, and I thought I ate pretty healthy at the time, but I clearly didn't understand the impact of plants and on disease prevention and what I was doing when I was eating animal products and processed foods and things like that until I watched those documentaries. So my whole family went whole food plant-based. And then it was then that I really just dove in, and I knew that I had to share this information with my patients and with my community and with my own families. As my current roles, I work as a nurse practitioner in allergy immunology. And of course, immunology is that study of disorders affecting the immune system. And both of my roles as an instructor as well, I work at Chamberlain University teaching population health. But I think all of these roles you can incorporate lifestyle medicine into, right? It's part of being a nurse. I think it's part of our nursing responsibilities. And I think historically something nurses are very good at is to treat the whole person. And so I think that aligns well with lifestyle medicine.
Thank you for sharing that. I just want to ask you, how did you know or come across those movies that you watched, Hungry for Change and Forks Over Knives? How did you even discover that they existed?
I believe I saw it on Netflix or something. This is a funny story. My husband and I were, interestingly enough, on a cruise. It's the only cruise we've ever gone on. We were in the Mediterranean for our 10-year anniversary, and this is 13 years ago, and we were bored. And who gets bored on a cruise? I don't know. We did. And so I was like, well, let's do something on TV or on our computer. And we pulled one of them up, and then it recommended the other one. And we both were like looking at each other going, oh my gosh, we've been doing it wrong. So anyway, that's how it all started, funny enough.
Mm-hmm. And what a place to discover that information on a cruise.
I know. I think we were at sea, and I was like, this is a boring day. And yeah. So
right.
Anyway, it was good though. Obviously, that worked out.
And you mentioned being able to bring these lifestyle medicine tenets into your practice. Can you give us some examples of the ways you do that? Either whether it's the teaching or the clinical role?
When a lot of people think of allergic disease, because again, I work in allergy, a lot of people think it's genetic, and there is certainly a genetic component, right? If one parent has allergies, a child is 50% more likely to have allergies. And if both parents are allergic, it's 75%. And about over 40% of people suffer from some sort of allergic disease, whether it's allergic rhinitis, food allergy, eczema, or asthma. And we know genetics really can't be altered necessarily, but there's a lot of other factors that really have been linked to allergies, including lifestyle and environment, such as exposure to smoke, exposure to pollution, and even stress can all impact allergies. And so those are things that I have a responsibility to certainly address in my practice and make sure that a child I'm seeing is not being exposed to secondhand smoke, for example, or if my patient is a smoker, especially my asthmatic patients, if they're a smoker, I'm making sure I'm addressing that in every single visit and making sure they're making attempts to quit and helping them with that, of course. And another condition that I treat again is asthma, and my patients with asthma that are overweight or obese, they struggle more. And I recommend a plant predominant diet to really as a method of shedding some of that weight, because studies really show that obesity can make asthmatics more prone to exacerbations, and it makes these exacerbations even harder to treat. You have to use higher and higher doses of steroids to get them through an exacerbation. And then, of course, promoting things like physical activity with all my patients is really important, especially asthmatics, as this can really make a difference in their health status.
Thank you for sharing that. I think that is a big area, especially because I'm in primary care and we see those conditions very often, right? So tell me, when you were talking, I was thinking, I wanted to ask you, for both of those conditions, really, allergies and asthma, obesity, what do you think vulnerable populations face that may be different than more affluent populations? And how does bringing lifestyle medicine in help that? And then if you have any comments, you mentioned something about climate, if there's anything that about pulling in even environmental medicine. I don't know if that's something you do, but if you could comment on those.
Well, with regards to historically marginalized populations and health inequities, especially as it pertains to things like asthma and allergic disease, we know that these conditions do affect Black and Brown communities more than those that are than the white populations. And we know that things like climate change and environmental justice are true issues out there because those living in more urban areas, for example, tend to be affected more by climate change because there's less green space, for example, and there's more pollution in urban areas. And due to redlining, there's been populations are which is the process of where the government made certain areas of communities less apt to be offered home loans. And so this is why we see certain parts of the town where the life expectancy is much lower than other parts of the town. And these areas, for example, I know in Queens, New York, and in the south side of Chicago, these areas are closer to freeways, for example. And so they have a lot more exposure to toxins and things like that from vehicles. And so all of those are reasons we see these higher incidents of things like asthma and allergic disease as well. So those are just some of the examples of why we see that. I'm sorry, I'm not sure I'm answering your full question,
No, that's
but
great.
I just wanted to provide some context there.
Yeah, that's great. And how does caring for them, bringing in lifestyle medicine, can you give an example maybe, or like a success you've had, or something, maybe something you're pulling in from a lifestyle medicine perspective that they might not have otherwise gotten, and how that resulted in an improvement?
Yeah, the nice thing about lifestyle medicine strategies, I think, is that they tend to be cost effective and many of them are free, right? It's something that we can absolutely implement at the individual level with our patients. And first of all, I think the most important thing is you don't go in and I can't blame the individual for their issues, right? We have to look at the fact that we know that the patient in front of you is comes from different circumstances perhaps, and it's not necessarily, if they are having a health issue, it's not due to a string of poor choices. Individual behaviors are dependent on the choices they have around them. And so we have to address these through the social determinants of health. So we have to screen for those things. Do you have access to, so I think this is our first step anyway, is do you have access to healthy food? Where's the nearest grocery store? Do you have access to transportation? Because if you're taking the bus to go to the nearest grocery store, you're limited. You can only carry 2 bags usually on a bus. So you have to think about those things. And do you feel safe in your neighborhood? Those sorts of things. Do you feel safe to go outside and exercise? Do you have access to a health club, or can you work out? All of those sorts of things you have to look at. Are you stressed? We know that allostatic load or stress, chronic stress, can cause issues with people's health, long-term health. And so we see more rates of hypertension and obesity and cancer. And that's a big issue. So addressing those things, first of all, I think is important. And then absolutely at the individual level, we ask our patients those questions, and then we, make SMART goals and say, okay, what can we do? How can we substitute the beef for beans, or something like that? You know what I mean? And so talking about the options they have and what is very doable for them. And then I think the other thing that I've done is really try to get involved at the community level. So you have to really go into your own community. You have to engage. You have to know your own community statistics. Like, I work with the King County Health Department, and we know that African Americans have much higher rates of hospitalization due to diabetes. They have much higher rates of hypertension. And so I'm working with local organizations that are actively striving towards achieving health equity and developing programs and participating in those programs. My friend Faith Nyong, who's a nurse practitioner locally, she is doing amazing work. She works with, I think it's 14 or 15 different churches, Black churches in the area. And she's asked me to speak, and my husband has spoken as a Food for Life instructor, and I participate with them. They go on walks on Saturday mornings. They're currently prepping for the gospel walk in Chicago. So really engaging in those sorts of things. And Faith does amazing work. She just had a webinar yesterday on cancer. She invites all the people again from these churches on a webinar, and she talks about cancer and how diet can prevent cancer and So those are just ways that I am plugging into the work other people are really doing and just offering my services. And so it's one thing to do the work at the individual level, but I think it's also really important to engage in the communities because you really have to build that trust. And I can't just go in and start my own programs, right? You have to go into the community where the work is being done and see how you can help out.
I love all that. Thank you so much for sharing all that. We've heard this theme of getting into the communities quite a few times in our interviews, and I think it's such a key area, and nurses are so well suited for that, right? Even our history, nurses going out on horseback into the communities. We were doing that long time ago.
But that's when I knew I wanted to be a nurse after my grandmother was a nurse and and we lived in a rural area. And we know that, again, health inequities exist too in rural areas. And my grandmother she'd just get a call like in the middle of the night and she'd get in her car and she'd drive 20 to 30 miles to go help whoever needed help. There wasn't a doctor in the area that did that. She was doing the work as a nurse. And so I was always inspired by that.
Oh, I love that. Such a great story.
Yeah.
And great history for you and your family, really. So
Yeah, for
I
sure.
want to ask you how you think your work and affiliation and collaboration with HEAL through the ACLM has helped build your knowledge base, provide or help you gain the confidence. What has that association done for you in terms of you being able to go out into the world and make a difference in this way?
Thank you so much for that question. I'm just so proud to be a part of HEAL, the Health Equity Achieved Through Lifestyle Medicine initiative at ACLM. I was honored to be the secretary over the past few years. And now the group is now led by the incredible physicians, Dr. David Bowman, Dr. Kabira Huff, and Dr. Daphne Bascom. I worked with Dr. Terry Stone and Dr. Marsha Gale Davis when we were the leaders. And this is just an incredible group of people that's really committed to improving the health of those most historically marginalized and affected by health disparities through lifestyle medicine strategies, right? So some of the things we've done are HEAL features speakers and really are people working in communities. Again, working in communities where the real work is being done to improve the health of those populations at the population and community level. And there are subgroups within HEAL that have been developed, the HBCUs, the historically Black colleges and universities. There's work going into that group to help medical schools. They're starting at medical schools at the HBCUs to embrace lifestyle medicine, community conversations with leaders in this space that are doing work all over the world, and as well as the project materials group, which creates materials that can be used in practice that promote health equity or have that health equity lens. And I love being able to work with this group because everybody's just committed and so inspiring. There was a nurse practitioner on, her name escapes me. You guys might want to get her on too. She's amazing. And she does a lot of mental health work and works with the sickle cell community and postpartum moms. And she spoke and I was just like, she's incredible. And we got to, at the last conference, had our meeting and I just keep meeting more and more amazing people. So that's why I get inspired. And I just love to hear the work that's going on and see what they're doing. We have a HEAL scholarship. I almost forgot the HEAL scholarship every year. They award scholarships to people that apply, that are typically people of color that are working again to achieve health equity in these historically marginalized communities. And many of them are nurses, many are medical students, there are pharmacists, there's dietitians, there's all sorts of different sectors of the population, and they give them the scholarship so they can attend the conference and take the exams and continue to contribute to amplifying that work, and especially lifestyle medicine as the primary modality of improving the health of these populations. So
that's great. So much going on. It sounds like
it's a lot. Yeah, it's great.
So would I be accurate in assuming that one of the ways you stay up to date with some of the evidence base would be through your work, through HEAL and through the ACLM? That's one of the ways I stay up to date, and we've heard that over and over. But is that how you stay up to date with what's going on? I guess for you in that community, as people are doing this more, there's some anecdotal stories, but there's also going to be things that have come out that are what we would call evidence-based, right?
Absolutely. Yeah. I think, of course, evidence-based practice is the best way to practice, of course. And I love that the American College of Lifestyle Medicine is a leader in research, in following the evidence. And again, that's why I belong to these organizations now, because they do lead the way. And if there's a better way, they're going to find it, and a better way to do something. And I think I'm going to follow the evidence. And I think that's part of our role as nurses too, is to understand how to evaluate research again and stay on top of the latest research, but be able to really look at research critically with that critical eye and make sure that evidence supports what we are doing in practice.
I know that's true.
Yeah.
I remember many moons ago when I was in nursing school, having that be driven home many times. So, what do you think is essential? What are some essential elements for you to be successful in what you're doing? Are there relationships? Are there support references? What makes it successful for you? And any key partnerships or relationships that you've had that has supported that?
Yeah, I keep bringing it back to ACLM and HEAL. I think when I first embarked on lifestyle medicine and was learning about it, I was like, oh my gosh, what can I do? Can I have a clinic? Can I start doing telehealth? And it's hard to do that, right? There's a lot involved with starting a clinic or starting a practice on your own. And so I tried to I had a website and everything, and I was going to do these video visits and things like that, but it was just so overwhelming that I was like, I don't feel like I can do this, and it can't be sustainable. I'm not. And so that's when I was like, why am I trying to do this rather than just incorporating and than just learning from the people that are already doing it. You know what I mean? And so it's so much more gratifying to work with a community of healers that is committed to improving the health of everyone through lifestyle medicine strategies. And so I was like, oh my gosh. So when I discovered ACLM, which honestly was only probably about 4 years ago, maybe. I think that's as long as I've been a member. Yeah. And I was like, okay, obviously this is the way I need to go. And so that's why I engage in the member interest groups, and I try to attend as much as I can. That's why I go to the conferences and I learn from these amazing leaders and the people doing incredible work and doing the research. So I think that's why it's so important to really stay engaged with organizations, again, that are credible and doing the work.
What have you found to be some really success, like some wins that you've had in your practice, and some barriers you might have had? Has there been any pushback from colleagues or your employer, or like how have you navigated some of that, whether it's been someone very supportive or challenging?
Certainly, challenges include bringing lifestyle medicine into the healthcare system as it exists, right? We know the current system is not necessarily set up to support I know we're trying to move towards value-based care, but it's fee for service. So those are the biggest upstream causes or difficulties, I think, in bringing it to the larger population as well as physicians. As far as promoting lifestyle medicine to my patients individually, again, certainly the challenges are difficult, especially time and that sort of thing. Again, I'm very careful not to blame my patients for what ails them, whether it's, again, their chronic health condition or their inability to manage stress or their addiction. I think the challenges are societal rather than individual. I believe it was Esther Perel who was talking about the fact of, like, why are we all depressed? Do we all have clinical anxiety, or are we living in a world that's not designed for human wellness? Are we living in a world that is consciously anxious, consciously safe? Are we having normal human reactions to a very increasingly eroding society, and unhealthy society with unhealthy choices out there, and we're being diagnosed and medicated and all those things. And again, that brings us to, of course, health disparities. And again, I know these don't occur due to just individual choice. These are due to the choices that people have around them. And so we have to, again, look at those determinants of health. So access to healthy, cost-effective food, access to transportation, what is their support system like, those sorts of things. So there's no easy answer, but again, getting involved and asking those questions, and getting involved in your communities and using our expertise as lifestyle medicine providers to work with our communities, work with our people in our workplaces, advocate for healthy food options in the lunchroom, advocate for not having people bring donuts and things like that to our clinics, and all of those sorts of things are possibilities.
Yes, thank you for that. And again, there's a theme through here, which is we are what we live in, our culturescape. Do you have any success stories of patients that you'd like to share or that come to mind?
Yeah, I think recently had an asthma patient who came to see me. I think they just needed a refill or something, but he'd lost 120 pounds over the past 2 years. Like, I hadn't seen him in ages, and I think his albuterol inhaler expired. He was previously on these high dose ICS LABA inhalers and was having multiple exacerbations and on oral steroids frequently. Anyway, he'd lost 120 pounds, and he did this all through diet. He eats mostly plant predominant diet now, and he's exercising regularly. And the reason I hadn't seen him in 2 years is he just stopped coming to see me. I didn't really need you. So I'm not terribly asthmatic anymore. I just need my albuterol refilled. So it's funny. I get those every once in a while, and I love it.
Yes, I love it too. He probably heard a message from you at some point. So, Deborah, maybe I'll turn it over to you if you want to bring in the Future of Nursing report, which really is an urgent call to action on our part as nurses to address health inequities. So I'll turn it over to you.
Thank you, Susie. And it's really an honor to speak with you. So this is a big one, a little bit of an introduction to this, and hoping we can just have a conversation about it. You come from a unique space as past secretary of the HEAL member interest group at ACLM, a nurse who's leading in lifestyle medicine, both as a nurse educator, a nurse practitioner, a servant leader in the HEAL member interest group, and a presenter at the FNP-C Lifestyle Medicine Education Series. So given this, might we speak to where you feel we are and what we need to do to bring together and create synergistic forward movement between, and a couple of things here. First is lifestyle medicine inspired nurses who are passionate about seeing lifestyle medicine as the foundation of healthcare. That's in one part of our energy. Then the second is the National Academy of Medicine Consensus Report, Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. It's calling on all stakeholders to support nurses as uniquely qualified to lead in addressing social determinants of health and the transformation of our health system. And then, as you spoke of your grandmother and how she inspired you to be a nurse, the history, the theories, the code of nursing with its roots and a paradigm steeped in whole person and environmental theory, social justice, and identifying nursing as a practice distinct from that of medicine in the way we know, both the science and the art. Given that, could we have a conversation about all of that, where you think we are, where you think we need to be, some calls to action?
For sure. I definitely think nurses are, I would love to see nurses become more involved and embrace lifestyle medicine and health equity initiatives. We know that nurses are the most trusted professions. And so just saying that is because we know people don't trust the healthcare system, especially those that are historically marginalized, but nurses themselves are trusted. And so imagine the impact we could make as compared to potentially other professions. And so we are all about giving and helping, and we have so much that we can do. One of the things that I do, one of the important first steps, I think, is surrounding the health equity piece is for people that look like me, a privileged white woman, perhaps, we have to recognize our own biases first. We have to look inward. Everyone has unconscious bias. I consider myself a great clinician and I practice evidence-based care, but I never even considered the fact that I could be treating some people differently based on their race, their gender, if they're able-bodied or not. But I found out I had biases when I took the implicit associations test. I'm sure you guys have heard of this. It's through Harvard, and you can take this IAT, and it's not perfect, but it does help you recognize, oh, maybe I have some unconscious bias that I don't see. And there's several different categories you can take from that, but specifically implicit bias, which refers to the attitudes or stereotypes that affect our understanding, actions, and decisions more in an unconscious way. And that makes them very difficult to control. So I think that's one of the first things. We look at ourselves, right? Because most of us, even if we don't think we're prejudiced at all, we do have implicit bias just by virtue of growing, but just by virtue of the fact of growing up in this society, right? That values some people over others. We are certainly shaped by these ideas. And so doing that is a good first step. We have to learn history surrounding systemic racism and how this has contributed to health disparities and health inequities. And even current day, we know there's a lot going on with regards to certain areas where we see, this even explicitly stated. So by addressing our own privilege and our own implicit biases, we can be better positioned to address it in the present. I know it's not comfortable. It's very uncomfortable, but there's a reason for that. And that's why we have to lean into that. We have to break silence on racism in our own circles, at home, work, in our organizations, and then understand that the patient sitting in front of you, again, they come from different circumstances from you. And that's where we have to start, I think. And then again, I know I've mentioned it previously, it's engaging, getting involved at ACLM Join the Heal member interest group. I love going there and just listening and hearing and learning from so many people and finding what you can do, because there is a lot. It's certainly a huge challenge everyone's facing, but there's a lot you can do at the individual level and in your own communities. And by engaging with these organizations, there's a lot more synergy and a lot more momentum, and you can really actively really make strides in achieving health equity. I hope that answered your question.
Thank you so much for that. That's really powerful. You're sharing that we need to first self-reflect, and nurses are called to be self-reflective, and then educate ourselves of what is the real history. And we are called to be lifelong learners. So you are actually just speaking there, the code of ethics for nurses and what we're called to do and be as nurses, which is really beautiful. And then applying it to this calling for the future of nursing. So first, as nurses, there we are. Then secondarily, what would be the next thing that you might share about your thoughts about, say, education, including possibly education that is not siloed, but any examples that you might see at your university or education in the community where you've talked about get out in the community, come together. If we're all in our own silos, the doctors are here and the dietitians are here. And just like we know in not neighborhoods and zip codes, when everybody's in their little space, how do we come together? Are there ways that you see or imagine or envision in education, in communities, in practice, any of these spaces that you see examples of or can dream of or make a call to action for this coming together so we know and can see each other in new ways?
I think identifying stakeholders in those specific communities or engaging with just identifying who are the decision makers, who are the leaders in those communities, and going, again, you don't just show up in a community and say, I'm going to start this program here. You go in, you talk to the leaders in the community and you say, what are your needs? And what can I do to help move this along? What can our organization do to help move this along? And if it's at your workplace, I think it's important to identify, again, leaders in your clinic, in your physicians in the area. We can have lunch and learns. We can have those sorts of things and offer the opportunity just to address any kind of topic on lifestyle medicine. Maybe even a quick, I don't speak from experience, by the way. I'm happy to be doing this specifically, but you make me think about how I'm in this massive healthcare system I work in, and it's like, how could I even start to make a difference? So I'm thinking, oh yeah, I could go into my clinic. I could have a lunch and learn. I could talk to all the doctors and the staff and nurses, medical assistants, whoever wants to come, and talk to them about how to engage their patients with diet, for example, or have it an open conversation. I don't know. Those are just some of the things I think about. But I think just identifying your local community resources and nonprofits that are doing this work and engaging with them, being like, what can I do? How can I help? Whether sometimes it's just financially, a lot of times it's time, a lot of times, and then once you've engaged with them and identify their needs, then I think you say, you know what, I'm actually an expert in what's called lifestyle medicine, and here are some ways that I can help contribute if you're open to having. Those are some of the things I think about.
Thank you so much for that. So that is all what you were talking about here, is going in not a full barrel saying, here's your answer and I have all the solutions for you. But as Dale Carnegie says, first seek to understand. So going in and getting to know them and asking, what can I do? How can I serve you? What help do you need? And then over time, just like we do with our patients, establishing that trust, establishing that respect, establishing that relationship, and then being able to share about that with materials or expertise, or bringing it together now that we know what the needs are and we know that community, we know that organization, being able to match that up with the intelligence of having been there and seeing what they needed and listened. And then something as simple but beautiful is the sharing of food, but making it a lunch and learn, which those can be really wonderful. Can you share, you have experience in the community, can you share a couple of examples of how you even approached it? Here we are, we're in this electronic age. Is it better with a phone call or a paper letter or an email? What are you finding are some approaches, or knowing someone who knows someone that can introduce?
Yeah, I think, again, I plugged into a couple nonprofits in the area just by meeting like Dr. Stephen Loam, who started plant-based nutrition movement here locally. And now it's led by Meryl Fury, who I know you guys know. And that's how I plugged into that organization. And then I believe my friend Faith reached out to them, and then they told her about me. It's just interesting because I don't know how we all find each other. That's how I linked up with Faith, who's again working with the local churches. And I think it's just a matter of really searching for local organizations. I think when you reach out, I think they're really willing to take your involvement however it is. So I think I did a Google search, and then I sent an email to our contact me section before to a local nonprofit. And those are just some of the ways that you connect. Thankfully, social media it's got goods and bads, right? But at least we've got the opportunity to pretty easily find people and organizations that are doing work. And then again, they're very willing to have you come help them or offer your services. One of the other things I know some people do locally is just go to the local library and do presentations for free. You just go, people sign up and they love that stuff, free education. And so those are all different ways to engage.
Love that, because libraries are such a resource for people who can't just have an entire library in their home, and we can help stock those shelves. We can do learning, and it's a win for the community library and for informing people and educating people and creating community as people learn about what you're doing. Another area that's really key is about our nurses, our boots on the ground nurses at the bedside. This is really has been characterized as really a crisis in healthcare today. We have nurses who were already stretched and stressed, and then we're post-COVID. The more the nursing ranks have been depleted by this, the worse it becomes for those that remain. And yet still, nurses at the bedside have the most time with patients, and are the most trusted, as you say, that Gallup poll that has nurses the most trusted profession for years. And the issue is really coming around and has been for the National Academy's nurse self-care. How do we help nurses to be not having actually worse health outcomes than, say, the average American in many ways, that donut that they grab in the nurse break room in between running back and forth with trying to locate a Dynamap or just the short staffing. Are there things that you might share about that issue of taking better care of our nurses at the bedside that are right there at the bedside, and how lifestyle medicine fits in with that? I think it's important not to burden our nurses that are at the bedside more, and yet how do we back this up to say this is a powerful means for those, as you say, finding those who hold reins of power to speak up to that and being able to do that to support our nurses. So who are the stakeholders? How do we get this out there, and how do we take better care of nurses so that they can take better care of themselves and the patients?
Great question. And I think I want to certainly acknowledge those frontline workers with COVID and beyond now that's having these lasting effects of being understaffed, and there's a shortage. I was watching the news just this morning. I know a local hospital, the nurses are about to strike, and they are just stretched way too thin. And it's having implications on patient safety as well as their own physical and mental health, right? So that's an issue that certainly I think hospital CEOs and organizations really need to take better care of their nurses because, again, we're the backbone of the entire system. And so we have to consider them and take good care of them. I think when it comes to them, nurses engaging in lifestyle medicine and I feel like nurses are often resistant to change. Aren't we all resistant to change? But it's often difficult. And we're all in this medical model of prescribing medications for conditions. And how do we break that, right? Absolutely, I prescribe medications, by the way. They're essential. But we have to use those alongside evidence-based lifestyle interventions as really the first and primary mode of disease prevention and treatment. So how do we get the nurses educated on this? How do we get the physicians educated on this? Because many lack the skills and the confidence to incorporate this into their practice. And so, again, I think it starts with education, especially when they're in training. If we can get lifestyle medicine education into the nursing schools and into the medical schools, that's going to completely shift healthcare. And again, they do have to improve their own health and wellness. We know that those healthcare providers that are practicing lifestyle medicine principles in their own day-to-day life, that patients are much more likely to engage and listen to those potential recommendations and think it can be done, right? We're examples of showing it can be done. And I think we have to engage with them and let people know it's definitely something that is doable and possible. And again, we have to really try to focus on getting lifestyle medicine education because it's evidence-based. We know this, getting it into the schools.
Thank you so much for that. Yes, it's where do we start to impact that circle that's more medicine because we're not using the lifestyle, nurses being able to take care of themselves, but being empowered to do to actually take that break. Yeah. And just a short little aside, I really believe that in the power of community of nurses, if we can empower nurses to get together. Just a quick aside that we don't need to include here, but when I was a floor nurse on a big med-surg unit, they implemented the Chronos clock system. And it said, when you clocked out, it said, did you take at least a 10-minute break for your break, but we were deducted for 15 minutes, or for your lunch, did you take at least a 20-minute lunch break? And so I stood there at the clock with all those nurse leaders behind me of Florence Nightingale, all that. And I said, they're charging me for 15 minutes and I didn't get 15 minutes. I got about 5 or 10. It said 5 or 10, 10 or 20. And I basically clicked no and no. And And then more and more nurses started clicking no and no, because none of us were walking off the floor and taking a break. We were charting at all of that. And so I just love the power of community. And if we can get nurses to feel that in this time when nurses are the most stretched and stressed, may be a great opportunity for nurses to raise their voices even more, and how we might empower them that way. As you said, find those stakeholders.
Yeah, absolutely.
And Deborah, what you described there for a second, we interviewed another person who is so passionate about nurses becoming disruptive, not antagonistic, but disruptive. And as a group, we could do that more and more by clicking those buttons or pushing some other buttons maybe. But
I love that. I love that. I know. I like. There's some. I can't think of who it is. It's lovely. I heard it on a podcast once, and it was a social justice leader, and she's. I don't need an ally. I need an accomplice. Like somebody that's willing to go to jail with me.
I love that. And that famous civil rights leader that said, "We're making good trouble," or something like that. He just,
yes.
Good trouble.
Yep.
I love that. I don't need an ally. I need an accomplice. Yeah. Those are beautiful. I'll get chills thinking about all of that. I want to circle back, if we can, just briefly to education. As a faculty, and you are influencing that cohort of students every single semester that you teach them, and you are weaving in lifestyle medicine. Can you share a little bit about how you do that, and also what impact you see it having on those students?
I love teaching. I teach population health and epidemiology at Chamberlain University, and I love that class so much. Some of the ways that I'm able to, some of the ways it comes up naturally, organically in our discussions, because in that class, we talk about the concepts of the social determinants of health. We talk about chronic disease. We talk about Healthy People 2030 and the initiatives and the goals of disease prevention and elimination and reversal. And so it really comes up organically. And sometimes for my students, more so than even myself, they'll be like, oh yeah, let's talk about diet and exercise. And we talk about things like programs and initiatives that are happening in their specific state, for example. And so it comes up in the discussions, it comes up in their papers. It's an asynchronous class, so it's all online, but that's some of the ways it comes up. I had a student one time bring up Dr. Michael Greger, and I was like, oh my gosh, you're speaking my language. This is great. And then I can prompt them with additional questions like you guys have asked me today. What are some strategies that you have for getting this out into your community, especially those most historically marginalized? Or what do you envision nurse practitioners' roles being in lifestyle medicine or in impacting the health of this population? Whether we talk about maternal and infant mortality, and what nurse, and they're nurses already, and they're doing the work like we talked about in the ICUs and in the ERs right now, and they're very stressed already, but now they're in grad school. But they have the best ideas. So I learned so much from them. And I'm like, oh my gosh, that's an excellent idea. I think we can do that as nurses. So I think leveraging the experience from all these nurses is one of the ways we do it. And I think we just all learn from each other for sure.
I love that. We all learn from each other. That is really important. Each of those nurses is bringing experience that any one of us haven't had, both personally, in their community, with their own health, with family health in the community, and at the bedside, because we're not in all these different practice areas or even in these different practice settings. May we ask, what would you say is your message for these stakeholders and colleagues about how they can help support, empower, deploy, and employ nurses so that nurses can practice at the full extent of their scope of practice, expand the ability of physicians and others to provide lifestyle medicine education and support for patients, while at the same time benefit from the nursing role in every practice setting to be able to bring lifestyle medicine into clinical practice, acute care, population health, wherever?
Again, I think It's a matter of engaging with them and getting them, by them, like the CEOs, the leadership of organizations. I think it's a matter of just continuing as nurse practitioners and as nurses. We find the leaders and we engage with them. And we say, I think we all agree that the current healthcare system has a lot of issues, and here are some potential solutions. So I think you've got to get their attention. You have to also come with some potential evidence-based solutions and be armed with that as well. It might just be so much as just asking for a meeting, right, at your organization, asking for that lunch and learn or whatever it might be. But getting involved just again at your local level, whether it's your community or whether it's in the organization that you work with, you have to identify who are the change makers and who are the leaders in the organization that really are the decision makers that you can engage with.
Thank you. So identifying and then just the power of a conversation, opening up and reaching out and having a conversation and seeing where it goes from there. One last thing, Susie, and then I want to turn it over, is about assets that you think from your experience with education, with as a provider, working in the community, assets that you feel would support nurses, advanced practice nurses, any of this effort to synergize between these fields that we've talked about that would be helpful to come out of this presentation.
Assets meaning like tools and resources?
Yes, tools, handouts, approaches, suggestions for methods to.
Right. I think, for example, in my organization, we use Epic. So advocating for things like lifestyle medicine vital signs in your EMR is one of the things I would love to see. We have a few, but it's definitely not as robust as it could be. So until that time, I use the resources available on ACLM's websites that they have for us to use. And then also working to push to get these things integrated. You have to, of course, show that it's a necessity, but getting things integrated into the electronic medical record is very valuable. I use a smart phrase that I've had for years, and I tweak it and I change it, but it's just like where you type in a couple things and it brings out a whole list of resources that I print for almost every patient. It's websites, it's podcasts, it's books, things that where I started, a lot of the books and things I first read that I offer, that I recommend to my patients. If they have diabetes, I'll highlight this one, say maybe start here. Those are the things that we know there's a lot of information out there, but there's providing patients with what you recommend is a good idea because there's so much confusion and conflicting information and not evidence-based information out there if they do a Google search. So I give them the resources that I recommend in that way. As far as assessing for social determinants of health, I think the American College of Lifestyle Medicine has a really nice handout that you can assess for those factors, again, like safety, housing, access to food, access to transportation, those sorts of things. There's a Neighborhood Navigator is a great website. I don't know if you've been on that. You go there and you just put in your your zip code and it pulls up all your local resources from if you need free medical care, if you need free food, if you need, and so it's a really nice website for patients if you that have a need in that area. Those are a few that come to mind.
Thank you so much, Susie.
Yes, thank you so much for sharing all of this great information. I know we've kept you like an hour already. To wrap things up, I think the last question or questions would be, what advice do you have for anybody, any other nurse practitioners or people who really want to be involved with underserved populations? Any specific advice that we haven't talked about or anything else that we haven't talked about that you think is important to share?
Like I said, I think I would love to see nurses just become more involved and embrace lifestyle medicine in general, and then look at how you can improve the impact on your community. by identifying the needs of your community, identifying the organizations that are doing the work and how you can participate and help out and maybe incorporate lifestyle medicine into these organizations that maybe aren't already doing it. And I think, again, going inward first and identifying your own biases and learning the history and all of those things are also really important. But as we already discussed, but again, I think there's so much we can do as nurses and nurse practitioners, and that we've already shown we can make a tremendous impact on in healthcare, that if we are perfectly positioned with lifestyle medicine and how we are the most trusted profession, the most caring profession, and patients are going to listen to us. They do listen to us. And so I think just trust that and just start making an impact. I'm sure everyone is already, but we can even make more of an impact on the greater system as a whole.
Yes, thank you for that quick recap. And what you're saying that maybe you haven't explicitly said, but what I hear is that you're saying for people to be curious and to take action.
Love that.
That's what I
great.
I hear.
That's perfect.
And as
succinctly
nurses,
stated. I love it.
As nurses, we do that anyway. A lot of us, it's part of I think people who are drawn to nursing anyway have those maybe personality traits or characteristics, and we can leverage that for good.
That's right.
So I really appreciate you being with us today, sharing this time and your experience. We really do appreciate you.
Lovely. I really appreciate it.
Anything else, Deborah?
I think that you really summed it up. I think curious, confident, I think it was the other word I was hearing, is that we've got this, the trust and the numbers and the paradigm of nursing and all. And so trust, confidence, and go boldly, like the Star Trek, go boldly.
That's right.
Out and just start reaching out to people. And one last thought, I think, as I think about when we were sharing around the idea of communication, community, and just connecting, is that I think in this era of loneliness and social isolation, there's a power that comes from those forces that want to keep the status quo. I mean, pharmaceutical companies really would like us to keep needing those pharmaceuticals for the rest of someone's life.
Right.
So when we're not talking to each other, when we're not connecting with each other, it's all fragmented, and we have the way things are today is that way. The Surgeon General is talking about an epidemic of loneliness. And so in some ways, it's the perfect environment for there to be everyone not knowing which way to go and not connecting with each other. As much as we know that the internet and all connects us, it also, we know that people feel disconnected. And so what this conversation has centered around and as continuing theme is community, connection, conversation.
Yeah.
And when we reach out, it may just be a surprise. Nobody ever called me and asked me about that. No one said, can I come and talk to you? No one said, oh, what can I do to help you? But when we connect, there's power. Yeah. And it used to be, we grew up in neighborhoods with porches and in neighborhoods and all of that. And now we're all running around busy, and that works against community. Right. And so we can disrupt things by talking to one another, meeting with one another, sharing. And it can be that lunch and learn. It can be that knock on the door to someone to say, hey, can I pop in? All of that. So
I love that.
It's a really powerful message coming out of this about connecting, community, conversations, and the power of just that. And then the action that comes naturally from it, the action of many together.
Absolutely. Love that.
Okay. Thank you so much. Both of you are so beautiful with the way you articulate everything. I appreciate both of you.
Likewise. Thank you so much.
You're welcome.